Today on the Charles River Orthodontics podcast, Dr. Kedkar is going to talk about the benefits of orthodontics for both children and adults. So at what age should children first be evaluated for orthodontic treatment?
The American Association of Orthodontics recommends that every child be evaluated by an orthodontic specialist at age 7. The reason age 7 is a crucial age is because this is the age that we can really start to determine any issues with development or eruption of the permanent teeth, in addition to any issues with jaw growth discrepancies. In most cases, when we see patients at that age, we will put them on a recall schedule. So we will see them every 6 to 12 months just to monitor growth and eruption. But there are cases that would benefit from early intervention, so we can address the issues when they start to develop.
So how can early childhood intervention help with development?
So there's really a lot of things that early intervention can help with, specifically with preventing or lessening the severity of certain issues. So some of the most common issues that we will do early treatment for are crossbites, unfavorable habits like thumb sucking, which can cause unwanted movement of the teeth, or also jaw growth discrepancies. So those are really the main issues that we will address in early, or we call it phase 1 treatment. We can also help with incorrect eruption patterns as needed in early treatment.
So for adults, what are some of the most common issues that they're having in orthodontics?
So adult orthodontic treatment can really address a wide variety of issues. One of the misconceptions is that adult treatment is limited in what it can do, but really most, if not all, orthodontic concerns can be addressed as an adult. So some of the most common ones we see are crowding, spacing, problems with the bite. We also will often treat adult patients to create space or ideal tooth movement to allow for ideal restorations like crown or implant, because if the teeth are not properly placed before these restorations are placed, you may not get a great aesthetic or stable result. So we can really help to improve that.
Are there any age limits for orthodontic treatment?
There is no age limit for adult orthodontic treatment. So I've treated adult patients as young as 18 all the way up until their 80s. So tooth movement is really possible at any age. The speed of tooth movement may slow down a little bit as you get older, but movement is possible at any age.
So how has orthodontic technology improved for children and adults over the years?
So orthodontic treatment has come a really long way. It's actually a really great time to be practicing orthodontics. Some of the biggest advancements have been made in 3D imaging and printing, also in bonding materials, and also the quality or scope of treatment that we can achieve with clear aligners, such as Invisalign. Really, all of these things together have not only helped to improve the quality of our treatment, but they've improved treatment speed and also the whole treatment experience, like in terms of comfort and convenience of treatment.
What are some of the psychological benefits for getting orthodontic treatment for all different age groups?
So there are a lot of psychological benefits with orthodontic treatment. One of the main ones we talk about is in terms of the aesthetics and appearance of your smile. Having a beautiful and healthy smile is a really important part of how you present yourself and self-confidence. So it's not just to look good, it's also to make you feel good. Some of the other psychological benefits come from improving the health and function of your bite. Really having a healthy bite can contribute to quality of life in a lot of different ways. So we're not just talking about aesthetic improvements, we're also talking about improvement in terms of how your teeth function and work together, and also the long-term stability.
Can you talk about some of the long-term benefits of properly aligned teeth for both adult and children?
Sure. So, in terms of the long-term benefit of having teeth that bite and function correctly, there is one of the most important things is that severely crowded teeth can be harder to keep clean. And sometimes it's really impossible to clean certain areas when they're very crowded. And so when you can't clean them properly, that does make a patient more susceptible to periodontal disease. And then untreated periodontal disease has been shown to contribute to overall systemic health in terms of inflammatory disorders and cardiovascular concerns. Another thing is that if you have an incorrect bite, or we call it a malocclusion, oftentimes that can contribute to not only pain, but it can also make you more likely to require other sorts of dental treatment in the future.
So, how about treatment duration? How is it different between a child or an adult?
There's really no overall difference between treatment duration. Really, the main factors that contribute to treatment duration are the amount of tooth movement that we need to achieve and also the treatment goals. So, that really is more important versus if the patient is a child or an adult.
What kind of advice would you give an adult who's hesitant to start orthodontic treatment?
The best advice I can give is just to come in for a consultation, because a lot of times the scariest part is the unknown. So when you come in for an orthodontic consultation, we will do a comprehensive exam, and then we'll also review treatment recommendations and options. One of the great things is that we have so many more options for orthodontic treatment these days. In the past, we were somewhat limited in the options we could provide, so adults were maybe more hesitant to come in. But with clear aligners like Invisalign, we've really been able to improve not only the aesthetics of treatment, but also the convenience. Another thing is that we provide completely complimentary consultations, so it's really a no-risk way just to find out more about your treatment options and recommendations.
All right, so how does orthodontic treatment affect pronunciation or speech in children and adults?
Orthodontic treatment in most cases does not affect speech or pronunciation, but actually in children, sometimes it can improve pronunciation. So there are some speech difficulties which tongue placement can be an issue. And if you do not have enough space for the tongue, that can make it more difficult. And so we can actually create more space so that the tongue can be placed properly when they're undergoing speech therapy. In some cases, like when we use an expander or clear aligners, patients will find out that the first couple of days they may have a slightly, altered S sound that they're making, but the great thing is that the tongue is very adaptable. So after a few days, your tongue gets used to the appliance being there and your speech will return to normal.
So, what are some of the latest advancements in orthodontic treatment for children and adults?
Really, the main advancement, like I said, that we've taken a lot of advantage of is in terms of 3D imaging and printing, and also in clear aligner treatment. So we have a 3D scanner in the office. Back in the day, you used to have to take the goopy impressions for not only your study models in the beginning, but also in order for us to fabricate appliances. But now we can use the 3D scanner. So first of all, getting a 3D scan is really just shining a wand on your teeth. So that is a lot more comfortable than having to have the tray with all the goop put in your mouth. But in addition to that, the 3D image that it provides us allows us to make a more accurate diagnosis. It also allows us to use 3D printing in order to fabricate the appliances. So we found that by incorporating 3D imaging and printing, the fit of our appliances has improved greatly.
How can orthodontic treatment affect overall facial aesthetics of children and adults?
So there's really a lot of things that contribute to an ideal healthy smile. So it's not only correcting crowding and spacing, which is an important part of it, but we also take into account smile width, smile arc, gum line, and also the proportions of your teeth and your smile. So these are all things that we will take into account when we are designing your ideal smile and positioning your teeth.
Are there any particular challenges when treating adults?
No challenges. The main things that I find that adults are concerned with is they're concerned with the aesthetics of their treatment. They're also concerned with convenience, especially if it'll fit into a busy work schedule. They're also concerned with cost. So really, in terms of using Invisalign and clear aligners, that's allowed us to address a lot of the issues with the appearance of treatment because they are clear. It's not having braces on your teeth. It's also improved convenience. With clear aligners like Invisalign, we don't have to see you as often. So it reduces the need for in-office appointments for adults. We also have the ability to do virtual monitoring, so it can be done more on the adult schedule. We also have a wide variety of financial options in our office, so it can really fit into any budget that patients will present with.
How do you approach patient education differently between a child or an adult?
There's really not a large difference to how I address patient education. For all orthodontic patients, I think it's really important to provide detailed, straightforward, and accessible patient education resources. All patients should be made really well aware of not only their diagnosis and treatment options and recommendations, but also of treatment progress and of how to take care of their appliances. Really, the only difference is that when it comes to treating children, we will involve the parent with the education because we want to make sure that the parent can also support the younger patient through their treatment.
Well, Dr. Kedkar, thanks for coming on for another episode. We learned a ton, and I'm looking forward to having you back.
Thanks so much. Have a great day.